More than 122,000 people in Nigeria have received the AstraZeneca vaccine as full implementation has commenced in 32 states and the Federal Capital Territory. And as Nigeria's vaccination drive continues, authorities are warning Nigerians to beware of fake vaccines. The National Agency for Food and Drug Administration and Control says the public should ensure that the COVID-19 AstraZeneca vaccine being administered on them has the original label. Joining me to discuss this is public health expert Tui Mebawandu. Good morning.
Good morning.
Also joining me via Skype is epidemiologist and member Association of Public Health Physicians of Nigeria, Lagos chapter, Dr. Oladapo Ashinyombi. Good morning, doctor. Thank you for joining us as well.
Good morning to Nigerians.
Now, let's begin with you, Dr. Ashinyombi. How much of a concern this information from NAFDAC is? How much of a worry is this for you, seeing that we are in the middle of administering vaccines?
Is that question for me?
Yes, I said Dr. Ashinyombi.
Okay. Well, in any situation where you have the forces of economics, and in this case, health economics, that's demand and supply. So there's an increased demand for the vaccine now, and the supply cannot match the demand beyond what government has planned. Government has planned that this vaccination will be done in phases. So the people who are in phase 1, that's the frontline health workers and essential services, do not make up the whole of the demand. So people who do not qualify for phase 1 are desperate to get vaccinated, having seen that after 1 week, we are not experiencing the serious side effects that everybody is watching on TV. So those who took the vaccine after 1 week are like what I would call the natural guinea pig. And after they've taken the vaccines and they're okay, everybody now wants the vaccine. So the demand for the vaccine has now outstripped the supply. Generally, I'm talking generally now. So nobody wants to wait until it is their phase, until they're eligible to get vaccinated. That's why we'll go. And the moment you have that in a market, greedy people who do not have a human face, will take advantage, and they'll start telling you, don't worry, we can source the vaccine for you, which is a lie. 99% of the time is a big lie. And the next thing is fake products start coming up, and then they start offering people fake products. So my advice is people should only use the approved process, wait for their turn, and very soon they will all get vaccinated.
All right, let's bring the conversation to the studio. Dr. Mebawandu, talk to us now. How much of an obstacle does this pose in the fight against the virus?
It's quite challenging. Let's look at it. We shouldn't be seeing this kind of thing or this kind of information if government has done a proper rollout plan for this vaccine. We shouldn't be seeing it. Wait a minute. We have 3.92 million doses of vaccines. Nigeria has just done 122,000. That is 6, okay, out of 100,000 people vaccinated in Nigeria. It's like 0.0006% of Nigeria being vaccinated. We've seen a country, like Israel has done 80-something% vaccination. Absolutely. We've seen UAE have done as well as 53% vaccination. We've seen Seychelles, Maldives doing really high level of vaccination. We are not talking about fake vaccines, okay? Now the US does as much as 2.5 million vaccines every blessed day. We're not talking about fake vaccinations. Why should Nigeria, that is just doing 122,000 for the whole 2 weeks, be talking of this fake vaccination? So it's quite troubling that our processes are still bedeviled with a lot of corruptions and insincerity. Now, because, wait a minute, we have done a phase start. We're targeting 20 40% vaccination at the end of this month, and about 70% at the end of 2022. Now, what's the warehouse of vaccines we're having? 42 promises from AU, 42 million promises from AU, another 16 million from COVAX. Then MTA just gave us 300,000. You know, BUS we're expecting 1 million from there. So even the whole warehouse of the vaccines we're having, it's just too tiny. You know, but normally if the first start has been sincere, the communication has been thorough, and education has been proper, we wouldn't be seeing this kind of funny information about fake vaccine. Where it's going to come from? People they cannot even be sure that when they get to the center, they're going to get the vaccine. Though there are a lot of hesitancy. Don't forget about all the story about people are really ready to take the vaccines. I'm actually in the field conversing with people. Even doctors don't want to take the vaccine because there's been a big gap in communicating how to deploy the vaccine appropriately. What would be my reaction? Should I have side effect? What should I do? You know, those things are not in the public space. And then when those things happen and people cannot trust government, then people look for other ways to commercialize.
Trust is one of the main issues that is pushing this drive for fake vaccines.
Of course, trust is the main issue. Certainly, proper communication of the whole processes is not done. Proper education is not done. Because tell you what, you rather trust your personal doctor to say, I have vaccine, than look to the government. And that's where we are now. And that's why you see that that's God give the room for the fake vaccine to be pushed. And then there's a racketeering going on the ground where people say that, okay, you know what, the vaccine is free, we can give you for 30,000, go and gather your people. Those kind of things is happening everywhere, okay? And then the people, apart from the frontline health workers, which is the first one, and the essential security people, we're also looking at how do we now give these vaccines to elderly and people that are actually the high-risk people. We're not looking at how do we give it to people that are so disadvantaged, you know, at the villages, at the extremes.
And these are the people that they will take advantage of.
Indeed, so they'll take advantage of them. So what has happened is that we're seeing the politics of the vaccination, coming in and excluding people, pushing in fake, people trying to capitalize on everything that can bring them. You saw what happened with the what's it called, the testing.
Yeah.
For free, you know, if it got to how many? 54,000 naira.
Yes.
That is the thing that is happening to these vaccines now, and that's why the NAFDAC has to raise that alarm that. Are we seeing fake vaccine? But it's an indictment of that itself. Why should there be anything like fake vaccine in this country?
All right. Let me get Dr. Ashiyombi's reaction to what you have pointed out now. You mentioned a lot of things, Dr. Tui, and you talked about the issue of trust and government not having a proper rollout plan, which has to do with communication and education. Yeah. I wonder, Dr. Ashiyombi, if it's the same thing you are seeing as playing out as well.
Okay. Well, let me quickly correct an impression.
All right.
First thing is, from the numbers, we are not near finishing the vaccines we even have. That's number one. Number two, on social media, on regular media, government has communicated. Thank God TVC News can corroborate the rollout plan. The first phase is for people who are frontline health workers, who are members of the rapid response team, who are essential services, and this has been communicated. The next phase is for those who are supposed to be 50 years and above, and those who are 18 to 49 that have comorbidities. That means they have maybe diabetes, hypertension, HIV, cancer, but they are 18 to 49. The third phase is going to focus on states and local governments who have high burden of disease. And if you look at the NCDC website, you can easily know the states that have high burden of disease.
But he is talking about highly disadvantaged people who may not even have access to all of this information that you have pointed out.
Let me finish, ma. Let me finish. So let's first get this information out. The fourth phase is any other person who has not fallen into phase 1 to 3. Now, please, I would love to know people who will now call highly disadvantaged, who don't have, what I mean by that is this, who do not who do not fall into any of these 4 categories. All everybody needs to do, like I said before, is this is the rollout plan. Then let me give an example. For Lagos State, there are 88 vaccination sites, 88. And this information is out in the public domain. All people need to do is go to these places only if they are eligible. Now, Nigerians have a knack of wanting to beat the gun. And the moment you try to do what is not official, then you fall into the hands of people who take advantage of you. This information is out on social media, is out on regular media, is out by SMS. Now, part of those who are part of this vaccination, team, are people they call town announcers and community mobilizers. Now, these town announcers and community mobilizers are to try to reach only those who are eligible. Please, let's remember that this is still phase 1. This is strictly for frontline, so it is not for the whole population. However, people who are not eligible, Nigerians and non-Nigerians who live in Nigerians who are not eligible, are the ones looking for vaccine at all costs. It is not people you call those who are disadvantaged. That word disadvantage is something we all need to clarify. All they need to do, whether you are advantaged or you are disadvantaged, whether you live in Badagry or you live in Lekki Phase 1 or you live in Ikoyi, there are health facilities where you can go. People in Badagry don't need to come to Ikoyi to get vaccinated. There are health facilities in Badagry where the so-called disadvantage that you said, they know they use this health facility for regular routine immunization. And so they just continue doing what they need to do because it's COVID. That is the way government has planned it.
All right. Thank you, Dr. Oladakwa. But quickly, Dr. Tui, maybe you'd like to clear these highly disadvantaged persons that you mentioned, because oftentimes we use Lagos as a standard for the country, but not every part of the country is actually moving, taking this fight head on, tackling it head on like Lagos State is doing.
Let's be clear about this thing. We tend to think that Lagos is Nigeria. And we also tend to think that the core part of Lagos, which is your Ikoyi, your Badagry, your central part, Ikeja, is all Lagos. Okay? I've done works in the riverine communities of Lagos extensively. It's a report you don't want to see. You know, extensively, it's a report you don't want to see. That once you move out of the core Lagos, the health situation is as worse as the remotest part of the northern part of Nigeria. And then secondly, when we're discussing vaccine rollout, we're not talking about Lagos. There's a Samfara there. There's Creek of Niger Delta there. Okay? Because the most important point is that how much people, what is the movement to those areas? Out of the 200,000 primary health care centers all over the country, how many of them are actually functional? We are the staff, we are dependent to all those places. Let us not just use Lagos as our standard of challenges of the health. Because again, when you are not having the right distance, this social media we're making noise about is just because you are in Lagos. You know, listen, I just came back from Jalingo, just a few days back, okay, to facilitate the program. I knew how that place was, okay? Yeah. Even if you move away from the Jalingo Center and you go inside, I knew how that place was.
Once you step outside of Lagos, it's a different thing.
Listen, in the whole Southwest, in the whole Nigeria, 70 to 80% of the medical practitioners are in the Southwest. Yeah, once you move out of Southwest, these are data that are verifiable. So then, how do you now drive vaccination if you cannot have health worker appropriately in a remote place of Ilela, you know, when compared to Ikeja, or when compared to Ibadan, or when compared to Abuja? These are not what we're talking about. So we shouldn't, Lagos is not our standard. Please, it's not our standard. Even at that Lagos, there are a lot of disparities. And for us, it must get to people that don't even understand what is COVID vaccine, even as long as we are, they don't understand, honestly. And that's why you see high level of hesitancy and refusal of the vaccine. Okay? Even now, 122,000 out of 3-point-something million. What percentage is that in reality? So we shouldn't. So
in the long run, what are the implications, and how would you want government to quickly address this?
indeed, what government needs to do, honestly, is to set up a proper communication that can reach to the remotest part, even the Farasime in Badagry, or even a remote part of what's it called, Iwopin in Lagos, or in the extreme of Lagos, to reach out to everybody, everybody in a language they can understand. That is very, very key. Guys, this is your time for vaccine. In fact, the most important thing is that everybody should receive a text message that, please, it's time for you to come and take your vaccination. Depending on the rollout plan, you qualify. Have you taken your vaccination? If you have this reaction, take paracetamol or take this thing or rub it. And then if it gets worse, this is center. This is the place you call. You know, that plan must be clear and made open to everybody. Now, the thing is that if you're taking your vaccines, these are the things you should look at before you take the vaccine. These are clear communications. So, well, if you're talking about Lagos, lucky them. But I tell you, most part of it, if you look at it, Kogi, Zamfara, or they've not even started rolling out of the vaccine. About 4 states, they've just stepped back now. Even some of the governors are saying that they don't believe in vaccine. So where are we? Do we now say that is justiciable? Do that exposes everybody to the beauty of the vaccine? No. So now, if Africa has taken 7 million doses of vaccine so far, compared to more than 480-something million deployed worldwide, and Nigeria has taken just 122,000, we've not started. We've not started. So then let us, it's a good thing for you to have a paperwork and say that, listen, you know what, we have this center, we have that center, go there and go to the centers. Which people are you seeing? Right.
Dr. Tuyi Bawandu, thank you so much, public health expert, for joining us, as well as epidemiologist and member Association of Public Health Physicians of Nigeria, Lagos chapter, Dr. Oladapo Ashiyanbi. Thank you, gentlemen, for your time on the program.